This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
In Matters of the Heart this week, we learned about the lifestyle changes that can improve our heart health. Eat a healthier diet, try not to get stressed out, get enough sleep, and just plain move.
But sometimes it can be hard to get started. That's why researchers say when it comes to your heart, tackle bad habits with someone who has your heart.
In a recent study, researchers found that couples who adopt new and positive health behaviors were more successful than those doing it on their own. Researchers followed nearly 4,000 couples and studied their unhealthy habits.
They found 48% of men were able to stop smoking if their partner also quit. Compare that to just 8% who had partners who did not quit. For women, the success rate was about half.
36% of women lost weight if their partners joined them in a weight loss plan, compared to 15% without a supportive partner. The men had a 26% success rate with a partner and 10% losing weight alone. Now, it's unclear why the relationship matters, but having some support may just be the secret to success.
But it may actually go even deeper than that. So let's dig into this and talk about love for a moment. You know the feeling, the fluttering in your heart when that special someone walks into the room, the butterflies that swim in your stomach when he or she comes to mind.
Have you ever considered the impact it can all have? It's believed falling in love can lower your blood pressure. It can also lower your stress levels, which may translate into a stronger immune system.
But a broken heart may also impact your health. How, you ask? Well, joining us today to tell us more is Dr. Stephen Hearn, who is the co-director of the Guerrieri Heart and Vascular Institute at PRMC. Dr. Hearn, thank you for coming in.
Thank you.
So let's get right to it. Tell me the truth. Can there really be an effect on our heart health based on love?
Absolutely there can. There is a very well-described heart syndrome out there called broken heart syndrome. The technical name for it is actually Takasobo's cardiomyopathy, which it was cloned out of Japan, where it's described as octopus heart, where your heart actually, through a lot of grief or stress, and oftentimes grief, actually weakens to function 50% or less from what it usually does. It usually happens in women who, I guess the theory is, are a little more emotional than men sometimes, and it's in times of high stress. The theory behind it is that it's a catecholamine or epinephrine overload that actually overloads the heart, weakens it. Fortunately, it's usually transient, but you can actually become very sick and actually hospitalized. And in fact, I have 3 ladies in the hospital right now with it. It seems to be more often during the winter. I think the darker months, it seems to occur more.
So are you telling me you really can die of a broken heart?
You absolutely can. We have seen it happen. You absolutely can.
Now, are there any symptoms of a broken heart?
They're very difficult to differentiate from a heart attack. In fact, they look like a heart attack. Sometimes the blood work reflects a little bit of heart damage, although milder than usually, a mild amount of damage than heart attacks, usual general heart attacks caused by blood clots. So the symptoms are very similar: shortness of breath, chest pain, inability to walk due to fatigue. The general symptoms of heart disease are applicable to broken heart syndrome as well.
Let's talk a little bit about being married versus being single. Is there any impact there?
Absolutely. I mean, any type of companion, studies have all shown throughout, it's been studied since the 1970s and on, if you have heart disease, a heart attack, congestive heart failure, your outcome's better if you have a companion, be that a significant other or even a pet. Pet owners, many studies have been done to show pet owners do better with heart disease than non-pet owners. So some other person or animal, I guess you could say, that's some object of affection seems to improve your outcome if you have heart disease.
So there was a study that came out recently saying the same thing with exercise. If you have a companion to do it with, it's better for you.
That's absolutely true. And also, if you have a companion to do it with, you're more likely to actually do it.
Things like kissing and intimacy, is that good for our heart health?
Absolutely it is. I mean, if you're healthy enough for intimacy, sexual relations, of course I tell all my patients, as their doctor, whether they are or aren't, that also depends on their underlying heart disease. If you have severe heart disease, a very, very weakened heart, you're on a lot of medications, you run around with low blood pressure, then a lot of times you're advised no. But for the average patient, heart patient that's had a heart attack, is functioning well, is back to work, by all means, it improves your outcome, improves your quality of life, and makes you live longer.
All right, so like taking it a step further in the intimacy department, you're emotionally ready to go, but physically, you know, you might need a little bit of help, and there's medications for that. How does that help, or how is that with our heart health?
Well, there are medications, and everybody's familiar with them. There is medications for men in particular for erectile dysfunction. Those are all come with a big black box warning from the FDA. So if you're on certain cardiac meds, mainly nitrates, or if you're taking sublingual nitro into your tongue for chest pain, the recommendation is none of those medications. The shorter acting medicines 24 hours, and the longer acting medicines 48 to 72 hours before or after you're going to use them. So you have to be careful, and you have to warn your patients on that, due to the fact if you take those meds with nitroglycerin, your blood pressure can drop. There are reported cases of people having heart attacks and even sudden death from taking them. So you have to, if you have a heart history, you absolutely need to speak with your physician, clear with your physician before any sexual relations.
You're talking specifically men, but I think I've seen medications for women too. Are those safe?
They are safe. The proof for those and the data for women is much less. I mean, there's not a lot of strong data out there. There's not a pill to get your wife automatically in the mood,
right,
as most men I think would like to have. It doesn't exist that I'm aware of.
Yeah.
But there are meds out there that have been tried, although they're not with the success of the medications for the males.
Okay, so what are signs that your body's telling you to either not be intimate or to avoid it? And I'm not talking about the honey, I've got a headache.
Right. Well, the typical signs that you would find with anything. I mean, if you find you're having, you know, chest pain with exertion, or you're more short of breath than usual, or you get sweaty just going up the stairs, whereas 6 months ago you were able to do it fine, or you have to stop 3 times to go to the mailbox, those are all sort of classic signs that maybe something is wrong with your heart, and you ought to get it checked out, not just, you know, for intimacy, but just for overall general well-being.
Right.
There's really no age cutoff. I mean, you know, age is not a prohibitive factor at all. I mean, you know, I have patients well into their 80s and 90s that ask about it all the time, and they're very sexually active and happy. So there's no age cutoff. It's just the general symptoms that you have for cardiac disease you look out for intimacy, same sort of thing. If you've had those issues out in life, you need to get it checked out before.
Dr. Hearn, things that's very easy to joke about, but information that's very important to know.
Sure.
Absolutely.
Thank you.
And to read more from PRMC about proper heart health, go to WBOC.com, click on our picture at the top of the page.
Okay, so you heard the doctor. Being in love is good for the heart. So maybe this Valentine's Day you want to fix the relationship that you're in. Well, it can be done, and fast.
Here are 6 simple things experts say will fix any relationship. Leslie Ann and George Cohn have been happily married for 30 years.
I think, honestly, we bring out the best in each other.
Well, she absolutely is the love of my life in so many ways.
But like any marriage, there's been struggles to work through.
We have different communication styles.
So we got to come to the conclusion, if she wanted help, she had to ask for it.
Dr. Lana Stahelli says couples have to be willing to put in the effort like Leslie Ann and George. Her new book offers advice to fix relationships in a snap.
Oh, you can turn it around in a month.
Lana's first tip,
The #1 relationship killer, I would say, is criticism.
instead focus on what's right with your partner. Number 2, don't let your arguments escalate.
We used to think that express your anger and you'll feel better. That's not true. The more anger you express, the more angry you feel.
Number 3, plan sex. Lana says in the first year of marriage, sex decreases by 25%.
Sex is the most bonding, chemically and emotionally, way we have of being together.
Next, keep your relationship fresh by trying new things together. Also, don't forget to make each other feel special.
And I think we often get into the habit of just sort of rolling through the day, and we quit treating each other as someone special.
Lastly, Lana says don't have the same conversation more than twice. It'll only frustrate you both. Leslie Ann and George have a few tips of their own.
A 1-minute compliment, a 30-second hug, and a 10-second kiss every day.
And never going to sleep, Matt.
It's a formula that's kept them happy for decades. Now here's a surprising piece of advice from Lana. She says if you've cheated, don't confess it to your partner. It'll only add to trust issues and make them feel worse. Lana's new book, Snap Strategies for Couples, 40 Fast Fixes for Every Relationship Pitfalls, comes out in April.
Okay, so we've been talking about love, and it made me happy to hear that Dr. Hearn talked about the positive impact about having a pet and the positive impact on your heart.
So if you need a pet, we've got you covered in today's Pet Connect. Sean's in Wicomico County hanging out with the cuties. Sean?
From big cats to little dogs, this is Tripoli, and she's also looking for a home. Coming up, we'll tell you a little bit more about her.
And this guy's going to tell us a little bit more about toy trends this year. Yep, Chris Byrne, the Toy Guy's back with a sneak peek at all the fun at this year's International Toy Fair. I personally cannot wait for this.
But first, we've been focusing on a healthy heart. Would you be able to recognize if someone was in trouble? Dr. Oz has more.
Hi, I'm Dr. Oz. Being able to recognize stroke symptoms can save a life. You just have to think FAST, as in F-A-S-T. F is for face. Can they smile evenly? A is for arms. Can they raise both arms? S is for speech. Is their speech slurred? And T is for time to call 911 if the person shows any of these symptoms.